The first time we meet, we try to say the differences about our practice so that we respect your time. And so our reception room is a reception area. It's not a waiting area because you're not going to wait. The only people really that wait tend to be the parents of the kids or the drivers of people whom you might sedate. So people that aren't in the chair might wait, but no one else waits. So we run on time and we pride ourselves on being on time. And so I think our reception area is the smallest that the fire marshal would let us make it. If it was up to me, we'd have no reception area at all, but I had to be talked off the ledge and told we have to have something. Well, we're very patient focused. We're always going to ask you what you want or what your goals are. We're not going to tell you that you need this or do this, do that. I don't make any decisions for people. I might guide you on some choices. I think another thing that people should know is I am a general dentist. So although I offer a lot of specialized services, we still have space for people that just want their teeth cleaned. They want a dental home should something go wrong, they can give us a call. That we're not just doing smile makeovers, we're not just treating sleep apnea, that we can clean your teeth or clean your family's teeth, take care of your kids. So that sometimes gets lost. Well, sometimes it's hard to remember the differences because to me it's normal. We invest a lot in technology. I may not be the first person to get something, but I'll probably be an early adopter. I want to make sure it really isn't, I'm not beta testing for a company. So we have ways of taking impressions for people that don't involve gooey impression material. Every purchase that we make isn't to make my job easier, it's to make the patient more comfortable or benefit them in some way. So if it means that we're going to be more efficient with our time, they're going to benefit. If it's going to make things faster and comfortable, then we'll invest in it. If necessary, we do offer drugs. Sedation dentistry has opened the doors for a lot of people that otherwise just wouldn't see a dentist at all. Anxiety, fear, even people that tend to have a gag reflex. Many times if we sedate them, the gagging goes away. So we can handle a lot of barriers for them. If there's something holding someone back, we can usually find a way. And barriers include financial. We have ways of using third-party financing to make it fit within anybody's budget. If anybody can drive a car, they can afford anything that we're doing. I had a person, he told me, he says, gosh, this looks like a Cadillac office, and really, I'm kind of a Honda. And I said, to be honest, you're going to get the benefit of a Cadillac dealership at the price of a Honda. And it's a business. We have to be competitive. And if I was priced myself out of the ballpark, then no one would be here. So we have to keep our fees reasonable. And so we can make sure that our fees are reasonable, and we have ways to make sure people can afford it. There's two ways of coming in. If people just want to kind of meet me and kick the tires, we offer free consultations. There's kind of a cocktail party style consult. We're just going to talk about what can be done in general. We don't charge for that. Sometimes it's the tour or the explanation and consult is done by a team member. If you actually want me to be able to quote you a price, then we actually have to do an exam for a nominal fee. Usually if you have dental insurance, usually it covers it at 100%, so it's really nothing out of pocket. But we then at that point can show you around and take a look and tell you what your options are.